Namaskar to all of you. Myself Dr. Ajit Singh once again in the class of the community medicine. Our today's topic is the usage of the epidemiology. While the study of the disease distribution and the causation remains control of the epidemiology, the technique of the epidemiology have a wider applications covering the many more important area relating not only to disease but also the health and the health services. In more utilization term, the epidemiology has defined as a means of the learning or asking questions and getting answers that lead to further questions. In this control, Morris has identified 7 distinct uses of the epidemiology. Morris was the great epidemiologist. So on that we have to go for the discussion. Out of them, 5 of which extend epidemiology beyond the search for causes of the disease and bring it closer to today concern of the modern medicines. All these factors are important. Out of them, first approach of the Morris is the study of the historically the rise and the fall of the disease in the population. Winston Churchill said, slogan, that the farther back you look, the farther forward you can see. The first use of the epidemiology relates to this aspect, that the study of the history of the disease in the human population. It is well known that the health and the disease pattern in a community is never constant. There are fluctuations both over short and the long periods of the time. For example, the first contribution of the epidemiology to the study of the coronary heart disease was that it was an endemic. Later on, many others such as accident, cancers, diabetes were found to be the epidemic. As old disease pattern, for example, smallpox or conquered new one, for example, legionnaires disease, Lassen's fever, AIDS, have been identified, in which epidemiology has played a major role. Epidemiology provides a means to study disease profile and time trend in the human population. By a study of these trends, we can make useful projections into the future, identify emerging health problems and their correlations. Second one is the community diagnosis. One of the uses of the epidemiology in community diseases, community diagnosis generally refer to the identification and the quantifications of the health problem in a community in terms of the mortality and the morbidity rates and the ratio, and identifications of their correlations for the purpose of the defining those individualizations or the individuals or group at risk or other in need of the health care. By quantifications of the health problem, we lay down priorities in the disease control and the prevention. Secondary quantifications of the morbidity and the mortality can serve as a benchmark of the evaluation of the health services at a later date. Thirdly, the quantifications of the health problems can be a source of the new knowledge about the disease, distribution and the causation and prevention. The community diagnosis has also been effectively extended beyond the population, distribution and profile of the illness to include the understanding of the social, cultural and environmental characteristics of the community. Epidemiological, therefore, has been described as a diagnostic tools of the community medicine. Third one is the planning and evaluation. Planning of the essential for the rational allocation of the limited resources. For example, in developing countries, too many hospitals have been built and equipped without the knowledge of the particular disease problem. In the community, epidemiology or the epidemiologics informations about the distributions of the health problem cover and provides the fundamental basis for the planning and developing the needed health services and for assessing the impact of these services on the people's problem. The application of the epidemiological principles to problem of the health care constitute the new epidemiology. For example, examples of the planning includes planning facilities for the medical care. For example, number of the hospital beds required for the patient with specific number of the hospital beds required for the patient and the specific diseases. Health manpower planning facilities for the prevention or the preventive activities, preventive services, screening programs, immunizations, campaign and provision of the sanitary services and planning for the research. Evaluation is equally important concern of the epidemiology. Any measures taken for the control of the prevent a disease must be followed by an evaluation to find out whether the measures undertaken are effective in reducing the frequency of the diseases. Evaluation is a control method such as hospital vaccine requires more than demonstrations of its effectiveness in reducing disease frequency. We have to measure the cost of the large scale applications in terms of the cost of the vaccine, trained persons, trained personnel, storage, transport and other factors. The value of the one method in relation to other is assessed by cost effectiveness studies. It is now being recognized that only vaccines got in time of the health services will have to submit to the evaluation. The development of the randomized controlled trial has made it possible to evaluate the treatment modalities on a firm scientific basis. Such trials have raised doubts about the utility of the multiphasic screening. Certain operative procedures, for example, tonsillectomy, varicose veins, stripping, prolonged hospitalization of the patient with myocardial infections, etc. Clarify it is not enough to know that a program provides some benefit. We need to know much benefit and at which risk and the cost. Next usage is the evaluation of the individual's risk and the chances. One of the important tasks of the epidemiologist is to make a statement about the degree of risk in the population beside the incidence rate and the specific rate, which are measures of the absolute risk for a factor to or a believed to be a cause of the disease. The risk of the wearing mongrel child and of the some hereditary disorders are classic examples of the evaluating individual's risk and the chances. The risk assessment for smokers and the non-smokers for selected causes of the death in relation to the cancer and the CHD or the coronary heart diseases is another well-known example. And next uses of the epidemiology is the syndrome identification. Epidemiological studies are also can suggest some syndrome identifications. Medical syndromes are identified by observing frequently associated findings in individual patients. It is worth recalling that although approximately 3,000 so-called syndromes are described in the contemporary pediatric literatures, a primary defect is known as only in about 20% of the diseases. Epidemiological investigations can be used to define and refine the syndrome by observations of the group, and such studies have been able to correct the misconceptions concerning many disease syndromes. For example, there was less appreciation of the two main types of the peptic ulcer, gastric and the duodenal, till 1920. But the poverty gradient in the certifications of the gastric ulcer and its absence in the duodenal ulcer lead to differentiations of the gastric and the duodenal ulcer. Another example is that of the Patterson-Kelly syndrome of the association between dysphagia and iron deficiency anemia. But when the association was tested by the epidemiological methods, it was not found. Recent clinical studies using plasma renin level have suggested that the etiologically, prognostically and the therapeutically distinct syndrome of the essential hypertension may exist. It is currently that the subject of the hot debate. So in this way, the syndrome identifications also can be done by the study of the uses of the epidemiology. So it is also the important use in the field of the community medicine. The next use of the epidemiology study is in the sector of completing the natural history of the diseases. The epidemiology is concerned with the entire spectrum of the disease in a population. The picture of disease constructed on the basis of the hospital patient is quite different from found in the community. The epidemiologist, by the study disease pattern in the community in relation to the agent, host and the environment factor, as it is better positioned to fill up the gaps in the natural history of the disease than the clinicians. For example, the outstanding contributions by epidemiology to the natural history of the atherosclerosis is the recognition that 1/3 to 2/3 of the all deaths due to the ischemic heart disease are sudden. For example, occur in the less than 1 hour. Hospitals studies would never have come to this conclusion, for most victims don't reach the hospitals. This gave tremendous impetus to the development of the intensive coronary care unit. Epidemiological investigations have yielded a larger amount of the data on the risk factors in relation to the chronic diseases. The impact of these findings on the knowledge of the natural history of the chronic diseases remains to be elucidated. Since the epidemiologist is concerned with all cases in the defined population, regardless of the severity or the sources of the medical care, his perspective of the disease is consequently the broadest. Now the next usage of the epidemiological study in the community is the searching for causes and the risk factors. You know, there are so many types of the health problems in the community, but if we have not the proper causes, then how we can think for the control of the diseases. So it is very important use that we can search the causes and risk factors in the community for the specific diseases, like epidemiology by relating disease to interpopulation differences and other attributes of the populations or the cohorts. Examples tries to identify the causes of the disease. The contribution of the epidemiology have been many in the regards. Numerous examples can be cited. Epidemiological studies have incriminated that rubella is the cause of the congenital defect in the newborn. The thalidomide is a teratogenic agent. Cigarette smoking is a cause of the lung cancer, and exposure of the premature babies to the oxygen is the cause of retrolental hypoplasia, etc. in the cases of chronic diseases. Half of the finding a single cause remains unfulfilled, but an important conceptual change has occurred, that is search for the risk factor. The concept of the risk factors gave renewed impetus to epidemiological research. The research for the causes and the risk factors will be a ceaseless effort, as our ignorance about the disease etiology, particular chronic diseases, is profound, not to speak of new diseases which are appearing. So, all these are the very important uses of the epidemiology in the community medicine. They also can be listed. Like first is to study the historically rise and the fall of the disease in the population. Second one is the community diagnosis, and third one is the planning and the evaluation, and fourth one is the evaluation of the individual's risk and the chances, and fifth one is the syndrome identification, and next is the completing the natural history of the diseases by the study of the epidemiology, and the last one is the searching for the causes and the risk factors in the community for the specific health problems. So in this way we can conclude the topic, the uses of the epidemiology. Okay, once again thanks lot of you. Jai Hind, Jai Bharat.